This is Steve here, and here's my why video. Why the testosterone replacement therapy, or really optimization therapy, optimization for life, optimization of my health. So, my story: I'm 63 years old, I'm a chiropractor. I've always been into fitness, started doing push ups, pull ups, and sit ups at age 14. So that makes it 49 years that I've been really involved in getting fit, staying fit, and really through my life, I've been fortunate that I've always stayed fit. It's ebbed and flowed in terms of my degree of fitness and competition, but I've always stayed fit, never been heavy, overweight, any of that. I've always dotted my I's and crossed my T's. So I thought, but always learning. So my short medical history, which unfortunately really isn't short, is that at age 27, I was diagnosed with something called achalasia, which is a rare, what they think is likely an autoimmune disease of the esophagus, so your swallowing tube. So there's three waves of muscular motion that push down the bolus of food and or liquid. And then there's something at the base of the esophagus called the lower esophageal sphincter. And that automatically, or should automatically open after that third wave or third push. And then whatever you swallowed goes into the top or the fundus of the stomach. So in achalasia, that doesn't work. The peristalsis is gone, and that distal esophageal sphincter opens when it feels like it. So things back up, it's very uncomfortable, it makes sleeping miserable, you have to sleep on a wedge. It's really a silent misery that people who have achalasia go through. There's really no good treatment for it. You can kind of start off with a stretching, what they call a pneumatic by air dilatation or dilation. Had that, temporary relief. But that again is ripping fibers, so boy, you got to be careful when you do it. You don't want to rip too many fibers. So had that done several times. Fast forward to age 46 when things got really pretty bad, and I did my first surgery, which was Heller myotomy, which is a longitudinal cut a little bit above and a little bit below that distal esophageal sphincter. And then what they normally do is what's called a fundoplication. So they rewrap that area to prevent anything from getting back up. So it's kind of like a mess. You're cutting it to make it open, but then you're rewrapping it to close it up. So you open it enough for stuff to get down, but not so much that it will get back up. So for instance, with GERD or gastroesophageal reflux disease, they'll do a 360 degree all the way around fundoplication. Whereas with a Heller myotomy, depending on the surgeon, they either do a 180 or a 270. Well, the surgeon I had was going to do that partial fundoplication, but when he went in, he found that my esophagus was so tortuous that he didn't want to do the fundoplication. Unfortunately, he was also a pompous ass, and he left clips inside of me. In addition, I told him, my wife told him, and my brother, who was present prior to the surgery, told him, please do not lay me flat during the surgery because I will aspirate, which of course he should know, as anybody with achalasia laying them flat will be problematic. So he did, and I did. I aspirated. Got a fever, very brief, thankfully, being fit and taking care of myself in all the other ways that I could had its big dividends because that saved me. I did not have any issues with that part of it. But I did have a big issue with the fact that he left plastic clips in me, checklist, put stuff in, take stuff out. Not so much for him. So the surgery didn't work. I started to have some relief for 6 months-ish, and then it got really bad. So at age 50 in 2010, I had an esophagectomy. I did a lot of homework on PubMed. I wrote to authors of studies. I wrote to 12 authors. I got 9 replies, which I was very pleased with. And I chose 4 doctors to fly around the country to meet. with. So my wife and I flew to different places to meet with the surgeons that I thought would give me the best chance of A, survival, frankly, and B, having a life afterwards. Because if you read about esophagectomies, the outcomes basically suck. Most esophagectomies are done because of cancer, so esophagectomies due to achalasia are rare. It requires a specific skill set to do that. I ended up using Dr. James Lukatich, thank God, incredible surgeon from University of Pittsburgh Medical Center. There are two different methods, basically, of esophagectomies, certainly at the time, and it was quite a process trying to figure out and make my way through the literature and all the things that I didn't understand and looking them up to try to figure out which method would be the best, but I chose his thoracic method, and they literally go through your thoracic area and go up and cut your esophagus out and pull it through your thoracic cage. So yes, I had a thoracotomy, and it's pretty ugly. And they cut nerves, so I'm going to show you here. If you look at my abs, which are not half bad, so here you go. My left side, pretty dang good. I'm pleased with that. Here, look at my right side. Look at the droopiness in the rectus abdominis, the slips of the rectus abdominis compared to my left. My left looks just as good as when I competed when I was in my 20s. A little dieting and I'd be there, but my right, I'll never get that back. I can make it contract. I can stabilize to do a lift, like a big squat or a big deadlift, but the looks of it are never going to come back to look nice and pretty like the left side. The other issue is the cutting of the vagus nerve, which is your rest and digest, your parasympathetic nerve. That brews a whole, oh boy, lot of issues, because if your vagus is cut, it's really hard to just kind of simmer down your life. So that is something that I frankly do struggle with and have to really work better on. So to get even a little deeper, they also had to do what's called a pyloroplasty. So the pylorus is the base of the stomach. So I had gastroparesis, or a paralysis of the ability of the stomach to churn the food. So they had to do like a rotor-rooter so I could get the food into the small intestine. So my upper GI tract is now an esophagus formed from the fundus of my stomach. They left a little piece of esophagus, original esophagus, and they do what's called an anastomosis. Yeah, I had to learn all these new terms. I didn't know any of this, which is basically a juncture point where they sew it together. And that is a skill set, boy, and you do not want to leak there. So Dr. Lukatich was an awesome surgeon, and I thank him for really saving my life. That said, I was told that I would never lift again. Oh, and I should mention issues with my heart. So when the food collects down at the base of the esophagus will enlarge, and that can put direct pressure on my heart. So that started to give me bouts of atrial fibrillation. That's no fun being cardioverted. That could be a whole nother video, but that's something that's been problematic even since. So yeah, this is not a sob story, it's just my history, and you know what? I'm actually quite blessed for the recovery that I made, because like I said, the recovery from esophagectomies, it sucks. I've talked to so many people that I could find, and there's not a human being that I know other than me that does more than just walk after an esophagectomy. I know zero people in the medical literature or talking in groups, zero people who are anything into fitness like certainly we are in the 100 Club. And those on Twitter that follow me, you know, we're really into it, and I didn't want to give it up. And my son was 3 when I had the surgery, and he said, you know, I like to throw him up and down. Like, well, you're not going to be able to do that. And I'm like thinking to myself, no, that doesn't work for me. So it was quite a recovery, and I took it really, really slow. I have a nice video that I'll have to re-upload and post of doing, if you know what I mean by a functional movement screen, very soon after the surgery. wow, it's something for me to see and remember. The other thing is I trained really hard for the surgery, both weight training and to the point where I could do 70 minutes hard on the Concept 2 rowing ergometer. So I wanted to get my aerobic fitness, my VO2 max up. I wanted to get my strength up because yeah, that surgery was 8.5 hours. And it took extra hours because of the plastic clips that the asshole left inside of me. And they had to go very slowly when they were refashioning my new esophagus to get the clips out so they could not mess me up further. So that's why I thank God for a surgeon like Dr. Lukatich and his team. And yes, he was in the surgery from the time we started to the time we end. And you better get close, real close to a surgeon, any kind of surgery, and look them dead in the eyes and say, are you going to be there and doing the surgery from the very beginning to the very end? And I mean very beginning to the very end. And are you on the same page with that anesthesiologist? Get in their face about it. Get in their face about it. And if you don't have a good gut feeling, don't use them. I'm telling you, don't use them. Because I've already told my wife, if I ever see Brant Oschlager, well, just get the bail money ready. So that's enough of a rant on that. So I was able to do my recovery and go very slowly, have a friend back east before we moved to Texas, because I recovered when we're still back east, who's a massage therapist who was just an incredible help to me, breaking up all the scar tissue and getting me to the point where I could actually hang from a pull-up bar within 30 days of the surgery. I was also out of the hospital in 5 days. That's even a whole nother story. They catheterized me every day so I couldn't urinate, and they wanted to do surgery on me. And I told my wife, even though I was doped up beyond the gills, I'm not doing any kind of surgery. We're flipping out of here. And the head nurse said, just please, I get it, because they could see my determination. I get it, but just please come back. So we had reserved a hotel room because I needed to stay an additional 10 days post the time I got out of the hospital to make sure there wasn't a leak at that anastomotic site, which we did. So we had the hotel room, and what did I do? I got in an Epsom salt bath, and I was able to avoid a bit. Thank you, God, for that. Thank you, God. Went back to the hospital, said I could void, see you later. Started to walk every day. I was even walking after being in the ICU for about 24 hours. I started to walk. So doped up, every tube you could imagine hooked up to me. The nurses thought I was completely a ding-dong and a whack job, and I guess I am. But in that case, it worked for me, and I was walking, just doing laps on the hospital floor. And I was out of there in 5 days. Look it up. That just doesn't happen. Started to walk, gradually got back into weight training. So that can be a whole nother video. I'll end that recovery there. But suffice to say, it was an ordeal. And the issues with my heart continued, and unfortunately have continued even to this day, although I do believe I've finally found a solution for that. So basically, at 60, I did a full powerlifting meet and did, okay. I hadn't really squatted much and benched much, so those lifts were not great. My bench has never been great. But I had a great day, set some records, that was good. Even at age 58, set a state deadlift record. And even at age 56, I won the tactical strength challenge twice. So after those years of recovery, it took me till about age 54, 55 to say, I'm starting to feel, not too bad, and I kind of like this kettlebell thing. I think I'm going to do this tactical strength challenge. And it's kind of run like a CrossFit where there's a leaderboard in the sky. And I actually won the Masters, 50 plus, internationally. So that was a pretty cool feeling, and it's given twice a year. So I did it twice that year, and sure enough, I won twice. And here's something interesting. So during that time, I had an implanted cardiac monitor because of the AFib. And the electrophysiologist, when I trained, I talked to him, and he's like, "What the fuck were you doing during this day?" And I said, "Well, that was my snatch test." So we had a good laugh. So never had a bout of AFib come on due to even maximal, whether maximal single rep max or maximal something like a snatch test. Never had it happen. Of course, that monitor was in for over a year. What did we figure out? Pretty much that much. So again, at 60, kind of felt like I just wasn't recovering right. And again, feeling like, I guess the best way to put it is a battery that normally charges to 100%. And my battery will only charge to 80 or 85%. And then from that point, it diminishes pretty quickly. So I decided after years of just doing pretty significant blood work and trying to figure out lifestyle changes, food, supplements, just really, unfortunately, not enough. I want to feel like I can go like those old movies where they push the stick and go forward, and it's that next gear, and I don't really feel like I have that next gear anymore. It may look that way in my training, and when I look at the videos, I'm like, wow, that wasn't half bad. But inside, it's the feeling that it gives me that I don't feel like, if I wanted another couple of reps or something a little heavier, I could really go for it. I kind of still get nervous about it, and I know it certainly affects my powerlifting, especially my favorite lift, my deadlift, where I used to be able to just let it all hang out, and I have that little bit there of doubt. So that's an issue that I want to get rid of. Not musculoskeletal doubt, although I've had a few curveballs, but frankly, as long as I consistently do my Stuart McGill Big Three every day, I'm totally good with that. So that's my why. That's why I'm doing it. I've done a lot of research. I've listened to a lot of docs, done a lot of reading, so I can feel knowledgeable enough to ask good questions. I think that's very, very important when you're looking at anything. You're not going to become the expert in the area, but what you really need to do for yourself is just get knowledgeable enough so you can ask the right questions, and you can get the answers that will make sense. So that's my why. I'll be talking more about this. I did choose Merrick Health. I followed Derek on More Plates, More Dates for a while. I followed Vigorous Steve, who I respect for walking the walk, and I respect for really digging deep into the research and really being able to explain biochemistry and how it all relates to this, not just saying something. He backs it up. So I really like that. There's many different viewpoints. I've looked at all the different viewpoints, and I really want to make sure that I take care of myself, because I feel like I got a lot more in me ultimately, and I want to make sure that I get that out of myself. So I decided on Merrick Health because they seem to have all the folks that walk the walk, as well as dig deep into the literature. It's not just a cut and paste, here you go, Steve, this is it. So I'll be posting more. Every Friday, I'll take some pictures, and I'll take my weight on the days that I do my scale weighing and injections. So I'll take my body weight on Monday, Wednesday, Friday, and those are the days that I'm doing the injections. So what am I on right now to finish up? 40 milligrams 3 times a week of testosterone cypionate, and then DHEA and pregnenolone. And starting with tadalafil, actually started 2 days ago. So that would be April 20, April 23, when I started with the tadalafil. So there you have it. There's me. Here you go, front double biceps. Hopefully those will get a lot bigger like they used to be, and we'll see. Take care.